It's Monday morning at New York Healthy Hospitals. Meet Michael, the RN on shift. He works in the med-surg department. He began his shift and is getting his report and list of patients. Michael will be the preceptor today for the new RNC, Herlinda. His first patient in room 44A is at the hospital due to COPD and is positive for the flu. Michael introduced himself and Herlinda, and while in the room, the patient begins to cough. Therefore, Michael decides to auscultate the patient's lungs. He also informed the patient that he's positive for the flu and will be monitored and given medication to treat it. Moments later, Herlinda sanitizes her hands before heading to the next patient, but Michael walks out and goes into the next room. Herlinda was concerned that he didn't wash his hands after being in the patient's room, but didn't dare to mention anything. The second patient in room 42A has diabetes type 2, is dehydrated with a runny nose, and lacks of appetite. Nurse Michael begins to assess the patient, and while he's checking the patient, Herlinda continues to contemplate whether she should say something to the preceptor. Herlinda decides she'll remind him when he's done. When Herlinda prompts Michael to hand wash, he says he must rush to the next patient and will do it then. Herlinda didn't want to be rude, therefore she kept quiet. She washed her hands and left the room. When the nurse Michael is in his third patient's room, room 43B, he realizes there's other nurses in the room. They were getting blood drawn from the patient due to his hernia repair that was scheduled for 2 days. While Herlinda entered the room, she realized that Nurse Michael had begun to place an indwelling Foley catheter on the patient and didn't wash his hands as he said he would. After he finished checking the patients, Herlinda saw the other nurses washing their hands, but Michael didn't. He just wiped his hands on his pants. Herlinda's worried that at this point, Michael is not practicing hand hygiene between patients. Therefore, Herlinda decided she had to speak to the preceptor in the hallway. Herlinda told Michael she didn't want to be offensive and decided to address the situation with him. She didn't want to ignore that Michael failed to perform standard hand hygiene precautions. Herlinda told her preceptor that proper guidance and training is critical. Michael told Herlinda that at this time he was going to wash his hands, but she will come to realize that nurses have some patients, that there's so many patients that there's not enough time for everything to be done. Herlinda understood Michael's point about the lack of time, but she was still disappointed with his response. Therefore, she just briefly expressed the importance of hand hygiene to him. Herlinda explains, while I'm not just your RNT, Nurse Michael, it is ethical to perform hand hygiene to prevent nosocomial infections. Nosocomial infections mean that there's hospital-acquired infections. Knowing when to use soap and water is necessary. So you need to know that when your hands are visibly soiled, or after eating, or when there's a patient that has an infection, or such as even diarrhea, such as C. diff, you have to use soap and water. And I understand that the patients you had didn't have diarrhea, but even just using alcohol hand rub takes just a few seconds and is important for your safety and the safety of the patients. 2 days passed, and the nurse manager on shift notified Michael about a meeting with the hand hygiene monitors. In this meeting, the hand hygiene monitors addressed the importance of what they do in the hospitals. They explained that they collaborate with the professional practice to enhance and educate healthcare professionals on how to protect and provide patient safety. They informed him that as secret shoppers, they observed many healthcare personnel daily fail to wash their hands, and that they want to intervene and reduce the risk of infections by addressing the issue. Consequently, he was invited to the meeting because his patient from room 43B was rescheduled for surgery. After all, she had an iatrogenic infection due to the lack of proper hygiene on Nurse Michael's part when placing the indwelling Foley catheter. They explained to Nurse Michael not only did they observe him not wash his hands, but there were 3 other personnel that were also witnesses in the room. In the meeting, they addressed the purpose of hand hygiene. Prevention of hospital-acquired infections begins with proper hand hygiene among healthcare professionals. Healthcare professionals fail to wash their hands properly which increases the risk for hospital-acquired infections, financial costs, mortalities, and morbidity rates. Hand hygiene is essential to avoid cross-contamination and breaking the chains of infections. They also explained that he failed to follow some ethical principles, such as morality and non-maleficence. And most importantly, he was not morally correct for not washing his hands and increasing the patient's risk for infections. Such behaviors increase the risk for hospitals and healthcare personnel to be sued for medical malpractice. Now, at the ending of the meeting, Nurse Michael acknowledged his mistakes, and he said he would begin to properly practice hand hygiene techniques. Well, hello there. I know this story might have seemed a little short there, Michael, but what is the ethical question of the story? Well, the ethical question of the story is, what ethical principles did you violate due to failure to wash your hands? As it was brought to your attention, morality and non-maleficence is two ethical principles that you failed to follow. And as a result, we saw the consequences of what can happen for simply not following basic proper hand hygiene. Michael, you have to understand, this story aims to show how many nurses on a day-to-day basis fail to wash your hands, causing the spread of infections. And at the same time, it's understanding that there's lack of time, and you have to rush from patient to patient. There's lack of training, lack of supplies, and it might be annoying to just take a second, just wash your hands. But you have to understand, I'm your biggest significant fear. Protect yourself and your patients from me. That is all, folks.